okay?
No good.
No good.
Shit. Uh-oh. Ouch. So Tash.
The background to what Quentin was saying before, I've sort of bounced around in EMS, humanitarian care, hospital management, and then just recently an EMS leadership position before moving into the dark side of academia full time at Notre Dame now in the School of Medicine, which I'm really enjoying. And then Quentin reached out and said, "Oh, would you mind talking about current challenges that you've seen in healthcare and what the solutions are?" I'm like, "Yeah, sure, that'd be great." And then I thought about it a bit more. I thought, I'm going to have to look into this with a bit more depth. So it sort of reasonably sounds like I know what I'm talking about. And then I said, I put together a bit of a slide deck and said, "What do you think?" And he said, "Yeah, no, I don't want to do any of that. Just want to talk about it." So I thought, okay, I need to memorise some of the stuff I'm going to be talking about. So a couple of the current challenges that I've seen and that are reasonably well known is around healthcare workforce at the moment. So the prediction is that there's about a 10 to 20 million healthcare worker deficit coming up to 2030, which isn't that far away, about 5 years. And from my personal experience is the current healthcare workforce is feeling a little bit burnt out and discontent in many areas. We came through COVID-19 and copped an absolute flogging as an industry. And I remember when the public health restrictions were lifting, we were thinking, okay, we're coming out the other side of this, and it was almost like the tap just turned back on again, full steam ahead. The reflection I shared with a colleague was that it was less about bouncing forward and more about bouncing back in many ways. Like a lot of the previous processes were put in place felt very bureaucratic again. A lot of the systems were very much compliance-based, and I know this sounds a bit negative, rather than giving clinicians the time that they need to work with patients. And that's pretty challenging, particularly when we see, on top of that, it's been posed as the looming aged care burden that's coming our way, which is sort of postulated somewhere between 1.4 billion people over the next sort of 10 years. And the big challenge I've seen with that recently, because I've heard before, okay, it's coming towards us, it's going to come get us, it's already occurring. So the recent sort of reports that I've seen around the place, that we've already seen around about 10% uplift in patients over 70 years of age presenting at EDs and presenting it across the system, which is a big tick up if we're just at the start of that. And most of those have multiple chronic conditions. Most of them have polypharmacy, so +5 medications on board. And they're really sort of not necessarily in the high acute setting, not necessarily in the low acute setting, but there doesn't seem to be any sort of space in between in the primary care setting to really lift and care for these people. So the system, or for what it's worth, seems to work exactly as it's designed. They either call 000 or they present at an ED. And then when we get these challenges, particularly I was listening to the ADHD presentation, I thought, there's a great question around how do we design our hospital and healthcare settings to be able to look after these people. In the same setting, we have elderly with cognitive impairment. The last place that they need to be is in a really busy ED with lots of noise, lots of lights, and lots of people walking around them that just makes their situation even worse. So how do we really set ourselves up for success when looking after these people? And we talk a lot, particularly in the healthcare setting, around the challenges that we face without really taking on board some of the extrinsic factors that are occurring. So we see in climate change particularly, and sort of, I guess, it's certainly a passionate topic of mine, when we look at disaster risk reduction and the social determinants of health, how the society around us is preparing itself or not preparing itself to be more ready for the changes that are occurring that will eventually spill over into the healthcare system. So we're already seeing increases in malaria rates. We're already seeing back in Perth a heat wave that's just pounding the healthcare system. We're seeing in the UK a hurricane pushing through at the moment. All of these spill into the healthcare system in ways where people have had health effects related to climate change. And it feels almost overwhelming. Well, to me it feels almost overwhelming at times. And the reflection that I had was, much to Quinton's point earlier, what are the solutions that we try to tackle in being more ready for this and more able to respond to it? In Australia, they've set up the Scope of Practice review that was recently released, which in itself, I'm not sure how many people read it, but it's sort of sets up a tempo of trying to redesign how different practices, particularly paramedicine got a mention, nursing got a mention, medical got a mention too, but didn't really sort of land, I think, where we need to set ourselves up. And when I say that, I always feel that sometimes these reports create an oppositional framework rather than a coordinated or collaborative framework to try and improve. And what I mean by that is we're going to continue to need acute healthcare services, and we're going to need more of it. But what we're missing is the lift up in the primary healthcare services in partnership or in parallel with that. I really liked the last presentation when it had referred to a GP for ongoing care. That really has a reliance on a GP being available to look after that person and that GP being connected to the broader healthcare system to be able to care for that patient and reconnect them into acute care services if they're available. So I guess they're probably some of my early thoughts on that, Quinton. I'm not sure if you wanted any questions around that, or if you felt that there was something specific that people wanted to chase down around healthcare challenges.
Well, it's all up to you guys. Where would you like Joe to go now? We do have probably about 10 minutes, so we are a bit tight on time. But does anyone want to ask Joe any questions on that, or any further direction for Joe? Mark, I'm sure you want to ask a question.
Many. So some of the last things you mentioned, Joe, were sort of like long-term climate change based, and I think America with massive fires in their winter time right now is stunning and shocking in all the negative ways. At the start, you mentioned how the culture pre and post the COVID lockdowns changed, and being Melburnians, especially, that has been a huge impact on us. I think, to borrow a term from a satirical ABC show, the term is future-proofing. And I think that going back to we have so many very specialist populations who have cares that don't need to be so intense, like a slightly sundowning older person suffering from dementia. An ED cubicle is the worst place to be, but we don't have an alternative. An older child or an adolescent patient with mental health or neurodiverse issues or both should have a quiet space. And my hospital, the Northern Victoria, we don't have that space, so they get punted out in the adult waiting room. I think physical demands are so high. We're struggling to meet the requirements we have just in terms of employment. We don't have enough doctors, we don't have enough nurses, we don't have enough allied health staff. But would a 5-year plan to invest in physical infrastructure, an addendum to a hospital, an annex, do you see that would help with staffing or actually make staffing challenges worse?
I think two things. Like you mentioned before around the future related to climate change. I don't think that's a future anymore. I think that's actually now. Like we're seeing those impacts. So 2024 broke previous records related to warming, and we exceeded the 1.5 threshold during 2024. Along with that, we've seen sea level rise increase to new records in 2022 with somewhere around 600 million people living at 10 metres or less above sea level. So that whole future of climate change is a bit like the future of the aged care bubble. It's not really a future, it's actually happening now. And the more we try to, or the more the narrative is around it's something that's going to happen, the less we invest in doing something about it now. The point you make around hospital and health service design, particularly the physical space, I think is really well made. But I don't think it should be isolated to just the hospital space. I think what I see is a bit of a gap in connectedness between the social care model and the healthcare model. And if we can bring those two together, particularly where, and I really like that presentation from Queensland, where they're trying to keep people connected in the community to their care plans so that they don't need to present at an ED. Although I would point out, because it sort of got the hairs on the back of my neck standing up, and the reason it did, so in ambulance in WA recently put in place a very similar model, and we sort of looked at the Queensland model for care in the community related to mental health and took a lot of really fantastic lessons from that. One of the things that really sort of got under my skin related to how we frame it up is the outcome basis of being ED avoidance. As soon as you create an outcome measure of ED avoidance, you create a mantra that people shouldn't be going to ED. Whereas there's always going to be some people that need to go to ED and should go to ED. But if you say our outcome measure is not going to ED, you can create a culture of you shouldn't be here. And I don't think that's helpful. But I think there's probably a bigger conversation around how we structure our outcomes-based care versus our activity-based care, which I don't think is always helpful. Activity-based funding just breeds more activity rather than better outcomes.
So, with all of these, we're always living in a resource-limited environment, and a lot of these ideas would be great if we could implement them in an ideal situation. In your personal opinion, looking at the healthcare system in general, where do you think we can get the greatest return on investment in terms of impacting? Where would you focus your resources at the moment to try and mitigate a lot of the challenges that you're referring to?
In that setting where you've got the power to make those decisions,
yes.
I'd be really focused in investing in the healthcare workforce into the future and aligning that with the social care model of health within the community so that they can better care for themselves. I think we inadvertently create a dependence within the healthcare system because of the way we design it. And that's really aligning the primary healthcare setting with the social care setting that then finally leads into the acute care sector if and when required and appropriate.
So can I add something a bit random to this in regards to competitive in healthcare? I do know that in WA specifically in secondary schooling, they've just introduced in Year 9 health studies providing primary health first aid. So students are now, as of this year, have been taught how to do those basic things. So I think it's starting at a school level, educating people how to care for themselves, as opposed to getting to the healthcare system when it's just a tunneling effect.
Yeah,
I think there's other things that in other areas that we're not aware of, such as school systems trying to educate.
I think that's where that social care alignment with healthcare really comes into effect. Particularly, I think what you've pointed out there is being able to enable early health literacy. I've seen positions start up in healthcare, they call them healthcare navigators, and wonderful people doing a great job, but just by virtue of the name being a navigator means people can't find their way through to what they need, which sort of is then a reflection on the healthcare system not being well connected at times. And a previous conference I was at, it's quite controversial. They were talking about the challenges of the healthcare system, and a young lady put her hand up and said, "What system?" I thought, but there's a little point in that, in saying that is it a system or is it a set of services that are predominantly driven by relationships. And when those relationships are weak or non-existent, then the person who requires care is not necessarily getting it in the most efficient or effective manner. Also a controversial thing to say, that if you don't open and unpack some of these things, okay, you know, like I've heard it from so many colleagues that are GPs saying, okay, how am I connected to the broader health system? And we look, and this is again the Australian model, where we've got a funding system that sits at a Commonwealth and at a state level, doesn't always talk to each other well, and then creates an unfortunate competitive environment at times. And that's, I guess, when we're looking at some of the future opportunities in healthcare, one of the things I've seen that gets touted a lot at the moment is AI, and at a personal level, I'm a little bit suspicious of it. I think it could well be an opportunity, and likely an opportunity, but I also think it could be a risk and a threat. In the military setting, we're already seeing AI-driven autonomous warfare. In the commercial setting, particularly with AI and data, there's a concern around, okay, what does that mean for healthcare data? It'd be unrealistic to expect that no one here has heard of Dr. Google. So when you're looking at being able to influence or provide good healthcare clinician leadership on what someone's decision making, there's now a counter narrative that's coming from other spaces, and we don't know how accurate or appropriate that is for that person. At a global level, the World Economic Forum just released the Global Risk Report, and across all sectors is disinformation and misinformation as being the biggest threat. Now they're looking at all levels, political levels, decision-making levels, but it's unrealistic to think that that doesn't equally exist in the healthcare setting, and challenge the healthcare setting about being able to provide good leadership and guidance around decision-making for someone's healthcare status.
It is almost time to wrap things up, Joe. Maybe to lighten things a little bit.
Exercise!
Yeah, no. What are some, I guess, do you see sort of as opportunities for everyone in the room as paramedics, nurses, doctors that may arise in the near future that we could be, going back to?
At a very practical level, I actually see sessions like this as being one of the fundamental drivers to keeping people connected and providing great care. So we're all in a space right here at the moment where we love being here because it's a great environment. People like skiing, people like snowboarding. That's an awesome opportunity. But in places like here tonight, when you're talking about emergency department care, mental health care, retrieval-based medicine, and sharing those lessons across clinician groups, they're becoming rarer and rarer moments where people can take the time to sit back, reflect, listen, contest each other about different decisions and different ideas, and we shouldn't lose that value, because it's a real opportunity for us as a healthcare workforce to stay connected. There's, like I've sort of come at it from a very negative angle, sort of showing what those challenges are right now and that are still going to emerge. But if we're all aware of it together and we continue to exchange knowledge on what's evolving and how we're going to tackle it, then we're better able to deal with those challenges as they continue to evolve.
Nice one. Any final thoughts, comments, feelings to share with the crowd? One more.
Sorry. When I'm going to go back to my my hospital, my local healthcare system, what do you think would be like lowest hanging fruit? So something you can just grab to actually have a practical impact in the next 18 to 24 months.
Sure. So when I was working in regional healthcare in WA, the lowest hanging fruit that I always saw was getting the community invested in what's happening in the hospital and supporting how healthcare is occurring within the community. And that, for me, was the lowest hanging fruit. And that was, I guess, the most important thing. And then the second thing was, I think, so often they're looking for leadership, or not necessarily leadership, but being part of their healthcare journey. That low-hanging fruit to say, what do we want to make our community safe and strong, and then when we go to make or to influence what decisions are made, then we do so as a collective rather than you as a leader of that healthcare institution or the local community leader trying to do it independently. As a unified effort, it's pretty hard to say no to when people, as you say before, resources are always really tight and you feel like they're getting even tighter. But if the resources required in your space are different from the resources required in my space and the next town over and the next town over, that local ownership around what your local demand looks like and having everyone on board in delivering it is going to produce the best outcomes.
Unfortunately, we are out of time, so we might call it there. But thank you very much, Joey, for sharing some of your thoughts. And yeah, I'm sure Daryl will hang around with any questions. So that draws us to a close of the whole week's formalities. With the closing party tonight, it's just a social event. I'm not going to be saying anything. There's no speeches, no attendance checklists or anything like that. So it's really just an opportunity to let your hair down and enjoy. We do have blue wristbands that we'll be handing out at the door. Just that will get you straight in and to the drink station there. We have Max, who's got some ready to go now, so you don't have to stand out in the cold. So yeah, thank you, Max, for being there. And just when you leave this evening, if you want to just grab one, that would take you much quicker into Sakaba, which is across the road. The most obvious sort of building there is Go-Type 2. Turn to the left, and it's just on the corner there. Thanks to all of you. We've been able to donate $3,000 from this conference to Orange Sky. So it's a great organisation. So yeah, round of applause. Each year we do look for a charity that we donate $10,000 to. So if there are any charities out there that's close to your hearts that you think is applicable to all of us in sort of the healthcare setting, please send them through. Let us know your suggestions because we're always looking for new charities to add to the list there. It's been an awesome week. Hopefully you guys have enjoyed it as much as I have. A really big thanks to our presenters. So a big round of applause for the crew that came along for that. Thank you also to our prize sponsors. So we've got Locum Life, Everest, and Emergency Fit. Yeah, round of applause for them. Thank you, Delphine and Max. And tomorrow you will be receiving a thank you email, which has an opportunity to just complete a feedback form. It's really quick, simple, but we do really want to look at just to continue to, I guess, improve our events. So any suggestions that you do have, please just take a couple of minutes to jot them down there, or let Dylan and myself know tonight. We'll definitely love to get around and speak to all of you. But that's it from us. Thank you all for coming. Be safe, and we hope to see you again very soon at 8:30 closing drinks. Enjoy.